to listen to Solutions Clinic. It's time for us to prioritize our health once again with the information we'll be getting on the show today. I hope you had a great weekend. Welcome. My name is Vic Riches, and I'm delighted to be having this conversation with you this Monday morning.
Good day, everyone. I am Dr. Tomio Petu, a public health physician. This is my reminder to you to stay safe, keep your homes clean and pest-free. Also remember to wash your hands regularly. And if you feel ill or any of your family members, please remember to see a healthcare provider first. Keep listening to Solutions Clinic.
My name is Opeyemi Adedeji, a resident doctor with the Department of Obstetrics and Gynecology, University College Hospital, Ibadan. To every woman out there, it's important to understand that pregnancy, labor, and delivery can be safe and seamless if we all participate in antenatal care and ensure that our labor is supervised by experienced hands. And to all caregivers, we must ensure respectful maternal care so that our women can have a positive pregnancy experience. Thank you very much. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So, my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
Shortly as well, the phone lines would be opened for you to call into the studio. To do that, the numbers are 0909 888 9939 or 0912 222 2939. All right, this morning we're going to be talking about meningitis. So we're going to be doing an overview of the illness and generally everything you need to know about meningitis. So last week Friday, the federal government allotted Nigerians of the outbreak of the cerebrospinal meningitis. Meningitis is an inflammation of the fluid and three membranes surrounding one's brain and the spinal cord. The government said that the warning became necessary as the disease is more prevalent during the dry season, which comes with dust, winds, and cold nights. The disease claimed 190 lives across the country last year. This is a report according to the federal government. The Director General, Nigeria Center for Disease Control and Prevention, Ifedayo Adetufa, revealed that Nigeria recorded 2,765 suspected cases and 303 confirmed meningitis cases, with 190 deaths across 140 local government areas in 30 states, and that include the Federal Capital Territory as at 2022/2023 statistics. And this morning, because we want to avoid these numbers from spiking even further, we'll be having this conversation to educate ourselves on meningitis. Joining me this morning virtually until he gets to the studio. Apparently, there's a lot of traffic in Ibadan, even as I was coming to work. It was unbelievable. I think the month just started for a lot of people, so the road is really busy this morning. But he's joining us virtually until he's able to get to the studio. Is Dr. Chukwuma Okoli. Good morning to you, Doc. It's great to have you join us.
Good morning, and thank you. Good morning, our listeners.
All right. So let's start off with, the statement with what the federal government said, that it is more prevalent during the dry season. Why is that?
Yes. Thank you very much. Meningitis is more prevalent in the dry season because the weather is dry, absolutely. Now, let me say the pathogens, the causative organisms are free to air. Okay? They are free to air, meaning they are available in the air you breathe. So it is more contagious just by inhaling. You don't necessarily need to stay in the same house with the person. Just by inhaling the air that is polluted.
So it's an airborne disease.
Yes, it's airborne. That is the point. It's airborne. So once it is inhaled, such individual or patient will come down with cerebrospinal meningitis. Now, like you had said earlier, what is meningitis? Now, most people just think that when you open the head, the next you are looking at is the brain. No. Even the brain has blood vessels on top of it. There are no blood vessels inside the brain, but rather on top of the brain. Okay? So we have blood vessels around. We have the pia mater, we have the arachnoid, and the dura mater. The pia mater, arachnoid, and the dura mater, these are the covering of the brain. And these coverings are very light coverings. Fungal meningitis, or what we also call cryptococcal meningitis. Okay, so depending on which of the organisms the person gets in contact with, either of them, the pathogenesis is the same. That is, how the disease comes to act is the same. The clinical symptoms are similar. So the most important thing is, either way, for us to diagnose it is important. So while we do the diagnosis, we can now say this type of treatment is necessary. But to the layman, what they know is they have meningitis and they want to be fine.
Okay. Oh, well, thank you very much. Doc is live with us in the studio. Must have been very hectic driving and talking. It's good to have you here.
Thank you.
All right. The last thing you mentioned, we're talking about the cause, which you just talked about, the bacteria cause and why it is even more prevalent. Now, let's talk about these symptoms. I've learned that if you don't present early at the hospital, the severity can lead to death. However, I think there's just one symptom that is pretty much familiar with a lot of people, which is the stiffness of neck. But I think that there are more.
Yes.
Okay.
The stiffness of the neck is the least that people should even worry about, because talking about symptoms now, there are more than one symptom that is available. Even this stiffness of the neck is found in other conditions, like cerebral malaria, which is a close differential. In fact, when people come down with meningitis, it is most likely they will develop cerebral malaria. Now, what is cerebral malaria? Probably topic for another day. But cerebral malaria is just malaria getting inside the brain tissue. So now we are talking primarily here about meningitis, which is infection of the covering of the brain tissue. So once the coverings are porous for those pathogens, whether they be bacteria or virus or fungal or cryptococcal, like I said earlier, either of them, once they find their way into the brain, there is trouble. The brain is a Pandora's box that cannot just be opened, and if anything get in there, it can create trouble. Apart from the neck stiffness that comes, there is also the loss of consciousness. There's also the stiffness of the muscles. We have what is called tonic-clonic. They could have a convulsion where their limbs are stretched, both hands and the legs are stretched and very stiff. And they may even have an opisthotonus in some cases where they are stretched like they see backwards. So it could get worse. Now, another close symptom is loss of consciousness. As a matter of fact, many times than not, most of them present with sudden onset loss of consciousness. And what do? At that point, you have to be fast with your diagnosis. You take a lumbar puncture sample of the cerebrospinal fluid, and then you make your diagnosis of meningitis through what you find in the fluid in terms of raise in blood cells, white blood cell count, and you could actually find presence of bacteria in the stream, in the CSF, and all that. And when this diagnosis is made, then you make your assessment, and then you go straight to the drug of choice based on the findings of the laboratory investigation, and you start treatment. However, it has to be very fast.
These symptoms that you mentioned, do they present immediately after contraction? Do you start seeing the stiffness of neck, losing consciousness and all the symptoms just after you contacted the virus?
Yes. Yes, in just a few hours, the bacteria, like I said, the causative organisms could be bacterial, could be viral, could be fungal. Now, then it's individualistic, depending on which of the causative organism that comes in. The cryptococcal, which is the fungal, takes a longer period before it becomes effective. The viral and bacterial are very fast. In fact, the viral is fast. Within hours, one can develop viral meningitis, and that could be fatal. Yes.
Because I read that people have died 24 hours after.
Yes, that's why I said it doesn't, unlike tetanus now that we know about, 3 to 21 days period. No, this one is very fast. It can be fatal. As a matter of fact, it can be fatal before the person even realizes that he or she has meningitis or goes to the hospital. It's that fast.
That's serious. So, what are the causes of this meningitis? What results to it?
Okay, like I said, it's bacterial cause, viral cause, and then fungal cause.
Because I heard something about overcrowding.
Oh, those are risk factors.
Okay, those are risk factors.
Yeah, these are risk factors
that will lead to it.
Yes, that will lead to it. Overcrowding, staying in a place that is choky, okay, and then living in area where people are noted to have had it. Okay, since we said it is mostly airborne, so it is contact through aerosol inhalation. So those are the risk factors that can predispose. And of course, we know there are vaccines for this, and that is why the extended program on immunization is very vital for the children. And then for the adults, they take all these top-up vaccines from time to time.
Speaking of the vaccine, so it's part of the immunization for kids at...
Yes, it is. It's part of the immunization schedule for kids. And then for adults, well, let me just say, in Nigeria now, for people who live in the north or who live around places where there are high prevalence of these, we know most times it's the northern part of the country. That's why we have high prevalence of this. And so people who travel to the north, probably via business or family, or who live there or have things to do there, they should be vaccinated. It's very, very pertinent that we vaccinate them. Now, this is the primary concern. Unfortunately, the country has a lot to battle with, and then health and health-related issues are losing relevance on a daily basis. And that's why I celebrate radio stations that have stuck to their guns in educating the populace about health and health-related issues. In 2019, that's December 2019, to the whole of 2020, the Nigerian country was held bound by a virus called coronavirus. Before then, we've had the Ebola virus and a couple of things. I still remember we lost a sage, a great colleague, Dr. Mrs. Stella Dadevo, to Ebola, that she herself diagnosed the patient of. I remember the one nurse who survived it, and then she said she watched the woman because they were put in an isolated ward. She watched her. It was a glass separated place, and it's unfortunate. So now you see, what am I trying to say? Health-related issues are there. People don't pay attention because they tend to occupy their mind with so many other challenges, money, food, and all that, forgetting that if any of these things should break out, even you and I would rather have to watch our left, our right, before we even step out to administer anything.
Fair enough. Well, you're listening to Solutions Clinic right here on the Remedy Dial Solutions 93.9. If you do have a question regarding meningitis this morning, make sure to utilize the platforms that we are on. We're streaming live on Facebook as well as YouTube at Solutions 939. So do all to ask your questions using that platform. Otherwise, you can send in a message on WhatsApp or regular text to 0904 422 2939. If you want to call into the studio, the number is 0909 888 9939 or 0912 222 2939. Other than the vaccine that you've mentioned, Doc, are there other treatment measures available for
yes,
it?
there are treatments. Of course, while talking about the symptom, we have mentioned them: the vomiting, the loss of consciousness, the fever, the neck stiffness, and all that. Now, treatment plan, you first of all have to diagnose accurately, is it about the immune system? And in such patients too, you should also watch out for cryptococcal meningitis, which is a fungal cause. So there are medications that it's an interplay of various medications. Your goal is to wipe the causative organism out, restore consciousness, because a lot of them do come down with loss of consciousness at that time of presentation. So you need to manage the interplay of these medications and then give the best, hoping that within hours of commencing, you start seeing improvement and then ultimate recovery on behalf of the patient.
So is that like a permanent cure after treatment, or does it resurface again?
Okay, good. This is it. And when the patient has been treated of meningitis, and then you repeat your lumbar puncture, that is, how did you diagnose? You take a sample from the blood to check for all those stuff. Then you pick your sample from the back, that's the spine. You put a needle within the spine and take out some of the spinal fluid and check. So you might need to repeat that to see that there are no causative organisms in the spinal fluid. At that point, you can say you have successfully treated the person. However, such persons now need to be vaccinated after the duration of the treatment. 1. 2, they need to avoid visits to places of higher prevalence or incidence of occurrence of it. Why? Not everybody comes down with meningitis. Now, for those who come down with it, they have 100% risk of having a reinfection. So if they have 100% risk, then they have no business in such areas anymore. Then they have to stay away from any area where it has been reported that there is higher prevalence of meningitis. So aside from taking the vaccine, they also outdo the avoidance, the social distancing, whatever, you practice all that.
Is the vaccine routinely or just one-off and that's it?
It's one-off. It's not routine. For the EPI, it's routine, of course, for the child, but for the adult, it's one-off. It's not routinely given, unless whoever needs it or requires it. It's available on demand. Let me just say that.
Okay. Speaking on late presentation, I read that there are severe complications that leads to that. What are these terrible complications?
Well, deafness, damage of the, it's an infection of the brain covering, and there's this thing we call cranial nerves. Cranial nerves are nerves. Like if I touch you now, you know I touched you because there is a nerve supplying that particular area of your skin. Now, there are nerves emanating from this brain. There are 12 of them. Okay, there are 12 of them that emanates. Now, the facial nerve is part of it. The facial nerve has an aspect that supplies the hearing aspect. Okay, so we have the vestibulocochlear nerve and so on and so forth. There are 12 of them. Now, the nerves involving in hearing could be affected, and it could lead to deafness. There could be, and patient could now keep having this repeat convulsion, because I also mentioned that convulsion is part of the symptomatology that comes with it. Even after treatment, the patient may keep having repeated convulsions, and that is now called epilepsy. So it is fatal, and it also could be fatal. Yes, it could be fatal. There is cerebral edema. A lot of things are involved in it, and like I said, it could be fatal. The moment the brain starts swelling, we shouldn't forget that our brain, in fact, we were taught years back that is one of the most feared complications, and it can kill. Once it gets to the point of the brain swelling, there's most likely herniation and there's death.
Oh, wow. Let's take this question. Good morning, Solutions FM. My name is Mrs. Happiness. My question is regarding my boy. He always has the stiffness of neck, but after 2 days of massage, it stops. So would I call that meningitis or just the way he sleeps?
Thank you. That's not meningitis. It's just 2 days, just massage. No, that's probably the way he sleeps. Okay, so just please, there is a pillow called memory pillow. Look for it.
Memory pillow.
Yes,
What does it do?
good. It's soft. When you lay on it, it will just accept your neck and your head the way you laid on it. Very soft, and it will make you sleep. It doesn't cause neck pain. Yes, so let her go for memory pillow, and any of those brands can sell it. Any of the brands that we know around that sells.
There's a pillow like that.
Yes, memory pillow.
That's
So just go for
interesting.
memory pillow, and all those things will be gone. It's the way the boy sleeps.
Okay, another question here. Good morning. My question is, does meningitis and TB act together?
Thank you. But I was having a discussion with a friend of mine, and then he mentioned having a separate lab for where he does TB investigations, and I'm like, wow, everybody runs away from TB because it's also airborne. So what is similar is the fact that both are airborne, transmitted airborne. If you have TB, I can't contact TB by touching you, but the moment you cough and you sneeze, and I take in those tiny droplets, I can be infected. So that's the only similarity between them. They are both airborne, but you cannot contact it via touching or caregiving. Once you have a patient you have to take care of, use your face mask. That's where face mask comes in. Use your face mask and you are covered. So that's just the similarity between them, is that they are both transmitted via aerosol and they are airborne.
Morning Solutions FM. My question is meningitis leading anybody to blindness?
Yes, it can. I mentioned the 12 cranial nerves. One of them is the optic nerve. So it's not just viral. It could be bacterial, and it could also be fungal. So all we need to do is just to be careful. If you live in an area where you know people have it, this is the best time for you to get. Those face masks are still very cheap now. I hope Corona doesn't come back. Is it Corona now? Corona. I hope it doesn't come back. So the face masks are cheap now. Buy them. Buy the one that has 50 pieces. At least you know you use it for 50 days. So please go on your face mask and you're sure you're covered. And then of course, social distancing. Those two. Touching does not transmit the meningitis, but staying closer to the person, you can inhale. So once you have your face mask covered and you keep a social distance, you are safe. And then get the vaccine. Free. Even if they pay, it's just free. Even if they pay, it's just something to have card or something. There's no consultation there. Just bring your babe and get injected with a little thing and take the angels away. That's all. So majorly they are free. They're free. Unless if it will be paid for, it will be something affordable. If at all you will pay for it, at least I give that to the general hospitals. It's always affordable. I'm talking about like 500 naira, 800 naira. You understand? Something affordable. So it's not something that will be expensive. So please, if you need to take it, just go. You could even be surprised that you'll get there that very day, and then before you know it, you are injected, and they tell you you are free to go, or pay 500 naira, pay 300 naira into one, and you're like, that's all. That's all. Yeah, that's it.
All right, this is my last question so far. If you have, please do send to the number that I called earlier. This is from Anytone, and I don't know if he or she is asking, good morning, Doc. Is there a distinctive symptom for meningitis? Most of the symptoms that you mentioned are related to other diseases.
Exactly.
So how are we sure that we're dealing with meningitis or not?
Thank you. It is not for you to diagnose. Let the doctors do that. If you have someone, yes, if you have somebody, those symptoms are like, even in the diagnosis, there's something called differential diagnosis. That means something that is a bit different from meningitis. I had mentioned cerebral malaria. In fact, they all come with the headache, fever, they come with the neck pain or neck stiffness, they come with the convulsion, they come with loss of consciousness. Everything is similar. So meningitis cannot be diagnosed right there in the consulting room. It's not easy to diagnose in the consulting room. You have to still see the doctor, and afterwards have a lumbar puncture. I mentioned the lumbar puncture. I mentioned the blood investigation. All those things are together. So all the things will now come together to say, yes, we either have a meningitis or no, we do not have. It is purely a doctor's thing in the hospital setting.
So at the end of the day, you have to go to the hospital. It's not for you to
Yes.
decide.
Yes.
All right, final words as we conclude this morning.
All right. Thank you so much. It's very pertinent that we all stay woke. Like I used to say, let's be conscious of our environment. When I see people wear face masks, I do not smile. I do not laugh.